South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family.
Greetings and welcome to our latest Let's Talk Your Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of STHS, thank you for joining us. If you want to improve your overall health, reduce your risk of chronic diseases, and enhance your overall quality of life, it's important to prioritize your physical, mental, and social well-being. So to help Rio Grande Valley residents get their health in order, South Texas Health System hosts these monthly Let's Talk Your Health webinars. Through education on common health conditions and strategies to protect your health, we hope you'll be able to improve your overall well-being. Now, in this installment, we'll be discussing weight loss. Essential for overall well-being, maintaining a healthy weight helps your body function efficiently and reduces stress on joints and organs, making everyday activities easier and more enjoyable. It also lowers your risk of chronic diseases while boosting energy and so much more. Unfortunately, 70% of Americans are considered overweight or obese, while only about a quarter of adults typically fall into a healthy weight range. So to help Valley residents manage their weight, we're joined by Dr. Luis Reyes, a general and bariatric surgeon who serves as the medical director of the STHS Bariatric Weight Loss Surgery Center, with some important education and advice. Dr. Reyes, thank you so much for joining us.
Thank you for having me.
Now, first of all, weight is an issue that I think a lot of us deal with, especially as we get older. I hear that the average person, once you turn 40, gains about 1 to 2 pounds a year if they're not careful. Is that right?
That's correct.
So over time, all of that excess weight obviously impacts our bodies.
Yes, definitely.
What are some of the common things that you see, complaints that you hear from your patients who have been dealing with excess weight?
Well, most of it is the difficulty to lose the weight, the extra weight, and the frustration for the gain weight. Most of the patients obviously wants to stay healthy, and through the years we have learned that unfortunately it is really not the patient's fault. It is a series of mechanisms, not only social but genetic, environmental, that brings us to the problem that we have right now. Mm-hmm. Unfortunately, it is a big problem because now it is where the overweight that becomes obesity will impact on our metabolic life.
But even just carrying 10 to 15 extra pounds can already start doing harm on your joints, on your organs. Is that right?
Correct. Little by little, our body is not designed for extra weight. So if we place the extra weight with the time, we just will damage the joints, which it's a problem. We will have more concerns with breathing because of intra-abdominal pressure. And then as an overall, fat is a concern because it is an endocrine organ in the body.
Okay.
And as it has some benefits, it also has a detrimental effect if it's in excess.
All right, so we have to be really careful. We have to maintain a healthy weight, and the best way to do that is through education. And you have a great presentation for us with some great advice to help us maintain a healthy weight, yes?
Correct.
Let's get started.
Well, most of the concerns right now, I just said, is education. And we need to understand several things. First of all, obesity, it's a disease. Sometimes we think it's just, the nice, chunky person, del gordito, they're so funny and all that. That's perfect. That's not the problem. The problem is that obesity unfortunately comes with other medical concerns, and that is where we have to focus. Not to make it difficult or complicated, but as I was saying, the adipocyte, which is the unit of the fat cells in the body, when it accumulates, it just serves in detriment to our health, because it does have the ability to produce, as you can see here, some what it's called cytokines, which are inflammatory substances that as an overall start damaging the body little by little. Here's an example how the cytokines, or the inflammatory molecules that happen in the fat, will produce molecules that will increase the resistance to insulin, promoting diabetes. It will follow with lipolysis, which is the production of free fatty acids that will go and make the vessels more susceptible to vasoconstriction, and then it will become hypotension. And as an overall, the concerns with the adipocytes are not only that it produces the cytokines. For example, it produces more estrogen. And the production of estrogen, especially in postmenopausal women that should not have this extra estrogen, will promote cancer, breast cancer specifically. And these are other, this is an example where this endocrine organ can damage our system, not just by metabolic disease, but by cancer, which is a major concern. Now, there are other functions of this adipocyte, which is, for example, the production of a hormone that increases our appetite. But it's the same when it is in excess and the production is not appropriate, then is where one decreases in order to the hormone to makes us hungry, increases and have predominance, and then we are a little bit more hungry than usual. So the first thing to think and to learn is that our fatty tissue in excess does not protect us for anything. Now, obesity, when we say, well, it causes multiple medical problems, well, let's just start here. Most of the things that we are concerned of is, for example, stroke. Obviously, it's a major concern in the United States, vascular diseases, and other problems will be cataracts, coronary artery disease because of accumulation of fatty tissue around the heart, the excess of work that the heart has to do because of the excess of body fat, diabetes, hyperlipidemia, hypertension. We also have patients that suffer from pancreatitis. As we can see here, the cancer that may promote the adipocyte are breast, uterus, cervix, colon, esophagus, pancreas, kidney, and prostate. So as you can see, it's a big gamma of concerns that we have here. Phlebitis, because the swelling of the legs and the increase in the size of the calf is because of our obesity. We have joint problems that are sometimes accompanied by gout. We have arthritis, as you mentioned before, when there's excess weight, our joints were not designed for extra weight. So it's a major concern, especially day by day by day by day. There's gynecological problems, and one of the few ones that we see, and most important, is the infertility. We see gallbladder problems, We see non-alcoholic fatty liver disease, which is a main concern now in the United States. We've seen this fatty liver going to steatosis, steatohepatitis, and then to cirrhosis. So we have this evidence that patients now with cirrhosis, we used to think that it was because they were drinking too much or they were not healthy. Well, now it's the problem is with the fatty tissue that gets accumulated, and the pulmonary disease because of the obstruction. There's an excess of pressure in the abdomen. This pressure of the abdomen decreases the function of the lungs to they don't expand as much as they should. Now there's an interesting process that is called sleep apnea, and it happens with patients that have obesity, and this is an interesting mechanism where patients are sleeping, they all of a sudden stop breathing for a few seconds, and then they breathe again. But meanwhile they're not breathing, the mechanism of emergency of the body tells the heart to pump faster because it needs more blood. This pumping faster obviously stops when you start breathing again. The problem is that over and over and over, this mechanism causes heart failure. So sometimes it's just not the obstructive sleep apnea that is going to hurt the patient, but it's going to be the heart failure, which is the consequence of this. And it's interesting because the patient comes to the office and I ask them, do you snore? They usually say no. And the wife right away turns around and says, no, wait a second. He doesn't know that because he's asleep, but not only he snores, but he stops breathing, and he scares the family members because patients stop breathing 4 or 5 times a night, and in the long run that causes the heart failure. So it is concerns that we have with obesity. So understanding that it can cause so many medical problems, so many situations which can obviously bring us to our death, we need to be sure that we take this seriously. How do we treat this? How do we improve the situation where we can say, I'm going to work on losing weight and it's going to happen? Well, lifestyle. One of the things that we need to understand is being active and eating healthy is the way we have to start with trying our weight loss. The diet. The diet is very important because we all have been in diets, multiple diets, and we have the paleo diet, the keto diet, the Mediterranean diet. Well, the important part of all the diets is how much calories are we taking and the quality of the food that we're ingesting. We have the guidelines of the food pyramids. We have the lifestyle pyramid in the left side, which is the older pyramid. We have the new triangle that just happened to be shown by the Department of Health, where I want to say, because there's some difference in this, but what is so important is not what's different, but what's important. The important part is sugar is the enemy. Sugar is the problem. It is true that before we thought that fats were the concern and fats were causing all these heart attacks and all these problems. Well, now we know that it's the excess on sugar, and the excess of sugar goes and in the liver it gets converted to fats, and that excess of fat gets attached to the heart, attached to the organs, attached to everything, and that is what it starts what we can call the metabolic syndrome. And the metabolic syndrome is when we start patients to see diabetes, high blood pressure, hyperlipidemia, and all these concerns that we know. So yes, sugar is the enemy. Vegetables and fruits are our friends. The more vegetables, the more fruits that we eat, it's much better. And it used to be that there was the healthy plate. That was another way to help patients to lose weight, to eat right. And half of the plate should be vegetables and fruit. Grains are very important. In the new guidelines, the whole grains are all the way down, which, it's a thought, it's a way to depict it. Here, the depiction is that we need to place more attention to protein, which I agree. Now, in the form of beef, or in the form of milk, or in the form of animal type of protein, we have to be careful, especially in patients that are senior adults, or patients that, for example, have the propensity to, let's say, colon cancer. Well, beef is associated with colon cancer. So those are the things that obviously we have to, with appropriate guidance, be sure that we eat the right food. Most of the time, there's things that we have to eat in moderation, and this is the things that the moderation should be for the proteins, the fats, and we have to be a little bit more liberal with the vegetables, the fruits, and then we can do the whole grain as an adjunct when we're still a little hungry. We have to also think about portion control. We cannot just go ahead and eat liberally what we want until we are satisfied. Sometimes we never get satisfied, or just eat because it's tasty. We have to be mindful that most of the time we don't need all that food. We also have to be mindful that we should not compare ourselves with others, because our metabolism is different, because our age, because our genetics. So it's important to have portion control of a healthy diet. Second thing is the activity. I have a lot of patients that get very frustrated because they exercise and they don't lose weight. Well, that's because exercise is mainly to get healthier, to become a little bit more active, means that we are going to improve our overall health. If we want to lose more weight, I think we need to place more attention in what we're eating. But if we want to also be healthy, exercise is one of the things that we'll have to look into. Aerobic activity, walking, fast walking, jogging, 150 to 300 minutes a week, which is roughly 2.5 hours to 4 to 5 hours a week, is what's recommended. Now, muscle strengthening, which is extremely important, especially if we have more of the protein intake. Protein intake used to be, the recommendation is 0.8 to 1 gram per day, per kilogram. Now it's up to 2.2 to 1.5 grams. So it's substantially more, but we have to exercise, and strength and muscle activity is so important, at least twice a week. Other recommendations are reduce sitting. Sitting is now the new form of smoking. Let's not sit. Let's be active. Let's walk. Let's turn off the television. Let's turn off the computer. Let's get up, move, and be active. With a healthy diet and activity, we are going to start working towards our goal of getting healthy and reducing our weight. Sometimes that's not enough. Sometimes we already have more pounds than we need. Sometimes we just cannot do it. Even we diet, we exercise. So medical treatment is the next best thing. Medical treatment has been a revolution lately because of the medications that we are now able to use. There were many medications in the past that were prohibited by the FDA because they were not the right gift to our patients. But all of a sudden, there is a boom of medications that are actually working appropriately. If you would see here, we have the sympathicomimetics, which what they do is they activate all our functions to make us a little bit more metabolically working faster, which not all of the time is good. And we're talking about phentermine, topiramate, medications that are to increase all our functions in the body. And that needs to be, again, given by a medical specialist because some of these medications can cause some heart concerns. Topiramate is another medication that comes with phentermine, and this medication actually used to be for seizures, but it also works well to decrease the appetite. So these few oral medications start acting and working very well. Now, acting and working very well, we're talking about 4, 6, 8 pounds. Okay, now there were other medications like orlistat, excellent idea. This medication will decrease the absorption of fat in the gut. But unfortunately, the side effects were too detrimental, so we kind of stopped using it. Actually, now it's over the counter, but it's not very well used. There's other medications like naltrexone or bupropion that decreases the anxiety, mainly in patients that have these stress eating concerns. But we have other medications like the Gelsis 100, and these medications, you take them, they increase the pressure in your stomach because it's cellulose, and then people don't eat too much. Unfortunately, it's very difficult to follow them because you have to drink water before, then you have to take several pills, then you have to take water again. So in order to do that every day, 3 times a day, it's very difficult for patients. So even though they're good, they're not invasive, it's difficult to follow. Then it came the revolution, and the revolution was what we call the GLP-1 medications. These medications started being studied for diabetes. So patients with diabetes were receiving these medications. It was excellent result. The result was, unfortunately, where these medications were having to be taken every single day. It was a little difficult, and then it got a little better to where then now these medications are taken every week in a small subcutaneous injection, and now even there now oral medications that are these GLP-1, which is a revolution. Now this GLP-1 is a molecule that actually it's produced by our body. It's endogenously produced, and it's produced in our gut, in the L cells of our small bowel. And this is where we can synthesize something that is endogenous to our body, but that works very well to increase the sensitivity to the insulin, and that's why it started to be used for diabetics. It decreases the liver fat, it decreases the hunger because it causes what you call gastroparesis, it slows down the stomach. It also increases the excretion of sugar by the kidneys, decreases again the satiety by going into the hypothalamus and attacking one of the receptors that causes hunger. So this analog was synthesized. Now we know it as those injections that we can take given by our doctor, sometimes by other practitioners. And all of a sudden they realized that, oh, it also helps to lose weight. So then now the FDA finally gave the approval where these medications can be not only used for diabetes, but now they can be used for weight loss. And they're very effective. You know, the phentermine, the pyramid, we were talking about 4-6 pounds of weight loss. Here, we're talking about up to 40 pounds of weight loss. We're talking about 10% of the excess body weight, 12% of the excess body weight that we're talking about. Now, one number that is very important is that once we are able to lose 10% of our total body weight, our metabolism resets. Our metabolism improves. And that is the goal of every practitioner that practices obesity medicine. We want to decrease at least 10% of the total body weight of our patients to start making an impact on their health. These medications, unfortunately, have not been able to give to some patients because of the cost. They're very expensive. They're still unfortunately expensive, even though there's promises that they will come down. Insurance are very slow on allowing us to give these medications, and sometimes there's some products that they sell outside, but we don't know what the source of these products are, and it's difficult to recommend for patients to take this type of medications, even though, again, not only now we know that it helps for diabetes, it helps to reduce weight, and now there's cardioprotective function of these medications. So as an overall, it has been a win-win for these medications. Every now and then, it is not possible to lose weight with medications because we already are too advanced in our weight, or we have to lose weight a little faster, or because of the inability to get these good medications, we have to look for other sources. And then surgical treatment is one of the things that we obviously advise. There's many procedures in the armamentarium of weight loss surgery that we have. Most important is that we have developed a way that instead of doing surgery that we used to open patients, now we do it with what it's called minimally invasive surgery, laparoscopic or robotic surgery, which are small incisions where we place our tools to alter the anatomy of the patients in order to lose the weight. And remember, I was telling you that these medications, going back to the medications for weight loss, they started by treating patients with diabetes, and then they figured out that they also help patients for their weight loss. Well, surgery was exactly the opposite. We start doing these surgeries because we thought we were going to help patients for their weight loss. And then all of a sudden we realized that is one of the best treatments for diabetes. That is an excellent treatment for high blood pressure, sleep apnea, heart problems, fatty liver. So it's a win-win either way. Most of these procedures that we do, we still don't know the exact mechanism. But for example, the gastric bypass, we know that one of its mechanism for weight loss is to increase the GLP-1 that we have in our body. So basically, it's like having a shot of these new medications when we do one of these surgeries, and it's for life. So here in the gastric bypass, we cut the stomach to have a little pouch. We route the bowel so the nutrients don't get all absorbed. And as an overall, we also promote the satiety because the patient can only eat small amounts. We decrease what we call the hormone that makes the appetite, that awakens the appetite, the ghrelin, and all these mechanisms are the ones who help the patients for the weight loss. We have another procedure which is very popular right now. It's the sleeve gastrectomy. The sleeve gastrectomy is basically to create a tube with a lot of pressure so patients don't eat a lot. We also decrease the ghrelin, which is the hormone that opens the appetite, and also increases the production of GLP-1, not by stimulating the L cells, by stimulating K cells in the distal part of the bowels. Now there's other procedures because again we have a large armamentarium in surgery. We have the single anastomosis duodenal switch. It's a more complicated surgery, but helps patients that mainly have an excess body weight of more than 200 or 300 pounds, and sometimes we have to help them with this type of procedures. We have a new type of surgery, new just here in the United States. It's been done in Europe and other countries for many years, the single anastomosis gastric bypass, which is another way to decrease the size of the stomach so patients don't eat too much, increase the production of GLP-1, which is an endogenous molecule that helps us to lose weight. It also decreases, again, the ghrelin that makes us hungrier and decreases some of the absorption of the nutrients. There's less invasive procedures that we have. For example, the gastric balloon. It's pretty simple. We place the gastric balloon in the stomach. We inflate the balloon with 500, 600 cc's of saline. The balloon can stay there for 6 months. At 6 months, we have to remove it, but it helps patients to lose an average of 30 to 40 pounds. We have other procedures which are less invasive, like the endoscopic sleeve gastrectomy. In some places in the United States is very popular. Unfortunately, insurance are not covering this procedure, so for us it's a little difficult here in the Valley to offer this type of surgery. As an overall, we have to remember, every patient is different. Every patient may be a candidate for good nutrition, for good activity, for some medication, and sometimes for surgery. My recommendation is always check with your family doctor, with your specialist, before you get into any of these plans to increase your health.
It's always important to have that relationship with your doctor so you're able to really create a plan that is right for you, because all of these options will really depend on how much weight you're carrying, your goals for how long you would plan to lose the weight, things, if you're dealing with any comorbidities, things like that. So it's really important to speak with your doctor. Now let's talk a little bit about some of the numbers once again. So when we talk about obesity, 74% of Americans are overweight or obese, 42% are obese, 9% are severely obese. And when we talk about those numbers, does it surprise you, especially nowadays, that we spend more time sitting than we do moving?
Correct. The inactivity and the unfortunate situation where food that it's less expensive, it's more available.
The fast food that we see.
Correct.
Every corner, you turn a corner and you see a different fast food outlet that is offering quick and easy food, and it's cheaper than you might think when you're buying groceries and planning for the week.
Correct. More available and less expensive. So people tend to gravitate to that type of nutrition, if we can call it nutrition, but yes, unfortunately has more carbohydrates, unfortunately based on sugar, which is now we know the substance that we have to, the chemical that we have to avoid. And the excess of this food and the lack of activity is what causes the epidemic of obesity that we have.
Mm-hmm. Now, women have higher obesity rates than men. Is that because obviously hormones, when we're dealing with the different hormones that women may have?
Yes, correct. Women have definitely a little bit more preponderance to have obesity, but mainly is because of the hormonal concerns.
Mm-hmm. And then ages 40 to 59 have the highest prevalence of obesity. So I am in that age range, and it scares me to think that, is that because middle age, when your metabolism starts slowing down and you're not really used to dealing with that? When you're younger, you're moving a lot, you're exercising, and even if you're not, your metabolism is faster. But as you hit 40, you start to see that slow down.
Correct. And unfortunately, at that age is when we start not only gaining weight in the form of fatty tissue, but we start losing muscle, what we call the sarcopenia, which is losing weight because of the lack of activity and lack of protein intake. Mm-hmm. So one of the things that we have in the new guidelines for the nutrition aspect is to eat more protein, because with age we lose more protein. Okay. And we have to pay attention to that.
Mm-hmm. Now, when we talk about our community, unfortunately, we've been voted the fattest city in America, the McAllen, Edinburgh, and Mission region, and the Brownsville-Harlingen area also ranks pretty high. Hispanics have the second highest rate of obesity. We're talking about diet, and we've grown up with tacos. We've grown up with all of these incredible foods, tortillas, but we really have to be aware that it is impacting our health. What we eat is impacting our health.
Yes, definitely. All these processed food that are available so easily everywhere have a lot of carbohydrates in form of sugars and fats. And those are the things that, even though sometimes we have to say, okay, well, in moderation, it's fine, we unfortunately don't have that moderations. We don't need one tamal, we eat 10 tamales. Mm-hmm. We don't need one taco, we eat 3 large tacos. And then we don't like to drink water, which is really the healthy beverage. We like sugary Coke and all these sodas. Then sometimes we don't have the knowledge, and sometimes patients, people think that juice, it's very healthy, very good. And most of the time there's a lot of sugar in the juice. Mm-hmm. Even when we talk about recommending for the patients to eat fruit, mm-hmm. we want them to eat the fruit with the fiber, because the fiber is what decreases the absorption of that sugar in our body. But if we just
drink the juice without the fiber,
then all the sugar it's ingested in our system.
And our body has no way of fighting that sugar, it's just going right in.
Correct.
And we also talk about, unfortunately, our next generation is also facing this obesity epidemic that we're seeing. So kids, adolescents are 20% obese. Those are kids 12 to 19, and kids 6 to 11, 18% are obese, which are some really serious numbers. We really need to be teaching our children healthy habits and role modeling those healthy habits as well.
Correct. The family, it's a nucleus where whoever is preparing the food needs to have a little bit more knowledge on what to prepare. But I think most important is whoever buys the food in the house. I always tell my patients, if you don't buy it, you're not going to eat it. And if you don't buy things that are not healthy, your kids are not going to eat it at home. So if we start by buying healthy food that is, as we depicted before, more into the vegetable, into the fruits, the healthy meat, the healthy fat, because also there's a saturated fat and then the unsaturated fat, and we should avoid the saturated fat. We have to pay attention, as I was saying before, on all the food that doesn't have all these processed chemicals that are not good for our body, and to increase our fiber. Fiber is now shown to be one of the most important parts to prevent things like cancer, ulcerative colitis, and other concerns, including obesity.
And I think one of the telltale signs when you're looking at processed foods is if it has a shelf life of more than a year, they're using all of those ingredients in there to make it stay on the shelf long, which means that it's not probably good for you.
Yes, and not only that, but every now and then if we read the labels, we see that there are ways to hide the sugars. Because we can say, okay, well, this one has sugar, this one has glucose, this one has fructose, this has sucrose. All this is sugar.
Just different ways of saying it.
Yeah, and it's, for example, in the new recommendations, they are a little bit more liberal on the drinking of whole milk. Well, unfortunately, whole milk is a combination of galactose and sucrose that are sugars.
Yes.
So we have to be careful with that. Also, as we age, our enzyme lactase in our body decreases in activity, so we may just get diarrhea if we drink too much of the whole milk. So we have to be careful, and again, the point of portion control should be very important in the mind of everybody that wants to stay healthy.
And whoever heads to the grocery store needs to have a list and try not to veer off that list, because then you start pulling things off and then you realize you've filled your cabinet, your pantry with food that is not going to help you if you're trying to maintain a healthy weight.
Correct.
Now let's talk a little bit about body mass index. We hear a lot about that. You, as a general and bariatric surgeon, do you pay close attention to a person's BMI when you're looking? Because I know that there's kind of like a debate whether your body mass index, because some people are thicker, some people are thinner, and so that BMI, how close of attention should we be paying attention to that?
So the BMI is a number that it's more accurate than just the weight.
Okay.
So we all are accustomed to talk about the weight, but then the height, it's another concern that we figured out that, well, not everybody is the same. A basketball player, this is tall and muscular, is not the same as the short person that has the excess weight, and both may have the same BMI. Yeah, but in a way, if we start looking more into the weight and the height, and it's the formula, which is now the BMI, then we can get to a number where we can talk a little bit better. It's not the perfect way to choose who is overweight or not, but it's the best, or one of the best ways that we have in order to say, okay, your BMI is 20 to 25. Well, that's a normal one, or what we consider to be normal. Then you have from the 26 to 29, which is overweight. And then you have from 30 to 34, which is obesity type 1, class 1, obesity type 2, which would be 35 to 40. And then you have class 3, which is more than 40
and above,
which is what we know, it's about 100 pounds overweight.
Okay.
And then we have more than that, which is the extreme obesity.
So if you're paying attention to your body mass index, if your recommended area should be 18.6 to 24.9. So if you're in that range, you're in the healthy range. If you're a little over that, 25 to 29, then you're overweight, and you should really be thinking about how to get your BMI back down to a normal rate.
Yeah, and I always tell my patients, just think about each number of your BMI is approximately 5 pounds.
Okay.
And those are averages.
Yeah.
But that way they can visualize how much do they need to lose or not. Not talking about the BMI, not talking about the weight.
Yes. So putting some pounds to it, so you know, as you're looking at your percentages, okay, I'm 2% over, that's about 10 pounds that I need to get down on the scale.
And if I'm five numbers up, you know, we're about 25 pounds that we need to start losing, 30 pounds, then we start getting some metabolic concerns up, then we start having more problems.
Now, another thing that we hear a lot about is belly fat. So we obviously, the BMI, you're paying attention to your BMI, but belly fat is very dangerous. Is that right?
Yes. Belly fat or visceral fat is what we consider the worst in promoting metabolic syndrome. So another way that we do is we measure the waist circumference on males or in females, and then we determine if the waist circumference is healthy or not. In men, more than 40 centimeters, or in women, more than 35 centimeters, is something that we consider unhealthy.
So it's paying attention to their waistline. That's the worst fat that you can have, and making sure that you're keeping a trim waistline will help you avoid any of those serious issues that you deal when you have that belly fat.
Correct.
Now let's talk about all of the conditions. You went through the list, and you were able to show the graphic that showed, but there are more than 200 conditions and diseases associated with excess weight. So when we're talking about it, it's from head to toe. You really need to be paying attention to your weight, because there's so many different issues that you could face with just even 10 extra pounds.
Yes. And these 10 extra pounds, they become 12, and then 13, and then 14, 15, and they go up. And then instead of getting better, we just get worse.
Now, when it comes to bariatric surgery, this is your area of expertise. How do you determine which is the right procedure for a patient?
We talk with patients, because most of these patients have been researching for up to an average of 2 years before deciding to go into bariatric surgery. So patients mostly are very knowledgeable. Now, when they are asking for our advice, obviously we want to see what's the excess body weight that they have. If they only have to lose, a few pounds, then, something like a balloon, a sleeve, something like that, endoscopic sleeve gastrectomy are pretty successful. But then when they have to lose more weight, then we go more to the gastric bypass, or duodenal switch, or even combinations. If there is no metabolic problems at the time of the consultation, then we're also a little bit more liberal. But when a patient comes and tells me, okay, well, I'm diabetic and it's a difficult control, then I tend to advise the patients that maybe the gastric bypass or a duodenal switch is much more appropriate for them, because we know, even though we haven't been able to understand 100% how it works, but the metabolism improves significantly with those procedures.
All right. And when it comes to bariatric surgery, I think there is a misconception that getting the surgery and you're done with weight issues for the rest of your life. But it is actually a lifelong journey. And we've heard it from patients from the bariatric center that they have to commit to a life of lifestyle modifications that they're making, eating well, exercising. It's not just you have the surgery and you're done.
Yes. And we see it over and over again. And you know, it's not only with the surgery, but also with the medications. And we have to start with the diet and the exercise. It's not that I'm going to diet for a little bit and exercise for a little bit and I'm going to become healthy. No, it's something that you have to develop in your life to do it basically every day. So the same as with the medications, you know, we cannot just take the medication and now I can eat everything I want to eat because I'm going to lose my weight. It doesn't happen that way. Doesn't work that way. And that's why a lot of patients that unfortunately waste their money in medications where there's no control, they're just wasting their money because they're not going to lose their weight, or if they lose their weight, they will regain it right away when they stop the medication. With surgery, is the same. We get the patient into a program where we teach them the value of the food, the value of the exercise. We teach them how it works, and we teach them that changing their lifestyle, it's the first step that we have to accomplish in order to not only to lose weight, because the losing of the weight is important, but the becoming healthier is what we are trying to achieve with all this.
So let's talk about some strategies when it comes to weight loss. And I think we have to think big picture. So one of the first things that we can do is set realistic goals for weight loss. I think many times, especially the start of a new year, we make a goal, but then we see that we're not losing the weight quickly, but it's all about taking the baby steps. So set realistic goals for your weight loss, that you're going to lose 1 pound a week or whatever it may be, but be realistic, right?
Not only that, even if you're not losing weight, meanwhile you're not gaining weight, it's a plus. So we just have to be, as you said, mindful that it is not a miracle. It's not like one day for another. It's going to take time, but we have to place the effort. Otherwise, we all just become frustrated. Oh, this doesn't work, I'm going to drop this diet. Oh, this doesn't work, I'm exercising and this doesn't happen. Oh, this doesn't work, I'm taking the medication and it doesn't work. No, it's just to be patient and
take time.
To be consistent with the message of get healthy.
Second tip, stick to a meal pattern. So deciding what are the best foods for you to eat and really sticking with it. And sometimes, yes, we may have to work late and grab something, but knowing that those should be exceptions, not the rule, that we have a meal pattern in place, whether it's the Mediterranean diet or whichever we choose, but making sure that we just have a lot of color on our plate, right?
Not only that, but we all know those very low calorie diets that they used to be about 500 calories a day. Well, they were not sustainable. The patients would lose weight for a month, but then after returning to the regular diet, they will gain it back again. No, go to a sensible type of eating. Figure out what you like and figure out the variety that you can incorporate for you and for your family. And that is the way to start to look into healthier foods with the appropriate amount.
Okay.
That way that we are unfortunately accustomed to eat, where everything is in the table and eat whatever, it's just not the healthiest way to be.
Which leads us to our next tip, which is manage your food portions. And I think we go to a restaurant, they give you a huge plate full of food. And I know that on Sunday I went to dinner and there were 2 of the steaks, and I just said, I'm taking one home. I automatically made the decision that I'm not eating both. But I think being aware of that and knowing if you're going to go to a restaurant, hey, these are some great leftovers that you can take, and dividing your plate automatically so that you don't just start eating, oh, let me pick a little more, and by the time you know it, you've eaten the entire plate.
And it's interesting that most of the patients have been addicted to buffets, where they go and for what they think is a small amount of money, they get a large amount of food, and they think it's great, not understanding that that food is going to, in the long run, increase their medical problems, which will increase their medical expenditure, which is going to cost them a lot of money.
So stay away from the buffet, which I always do. I always order off the menu because it's just a lot easier to know I'm just getting this and I'm not going to attack the buffet.
Yeah, and if they have to go to the buffet, they still can choose the healthier part.
Options.
Yeah.
The salad bar, unlimited.
Correct.
And just limited amount of dressing, but have all those greens and you're great.
Yes.
All right. Next one is make time for physical activity. And I think that one can be a challenge for a lot of people who have a desk job. But even just taking 15-minute breaks in between your day, in the morning, in the afternoon, and going for a walk, taking the stairs, parking the furthest away from your door entrance is a big step to being healthy and getting some of that activity.
Yeah, and the activity is what makes us healthier. That premise of let's exercise to lose some weight, well, that works when you're very young. That works when you're exercising in the gym 3-4 hours, or when you have a trainer. But for normal, regular people, you know, that doesn't work. And we have to understand that it is a way to become healthier, not a way to lose weight.
And the last tip is to really track your behaviors, because if you tend to stress eat, or you tend to go party and you overeat, if you're looking at those behaviors and you see, okay, when I get stressed, I start eating more of this type of food, it really allows you to really see, you know, what you're doing and how you can stop that behavior.
It's the way to start to say no. You don't want another serving? No, thank you. That was enough. Sometimes we don't know how to say no. And we have to, because otherwise we tend to overeat just to please somebody, to our detriment on health.
All right, and now when it comes to losing weight, losing 5 to 10% of your weight can make a big difference. So just thinking about that, knowing what is my weight, if I can lose just 5 to 10% of that weight, it will improve my health.
Yes.
So baby steps, right? That's what we got to think about.
Baby steps, and knowing that we have to read, because there's the total body weight and there's the excess body weight, which is very different. If I'm talking about the total body weight, yes, I need to lose about 10% to improve my metabolism. But if I'm talking about my excess body weight, then I need to lose 40 to 60% in order to improve my metabolism. So as an overall is just the numbers, but it's important to get educated in what we read and see.
And the thing when it comes to getting to a healthy weight, we all tend to rush to exercise more, to get more exercise. But 80%, 80 to 90% of our when it comes to maintaining weight, 80 to 90% is diet and 10 to 20% is exercise. So
Yes.
diet is the first place you need to look when it comes to maintaining a healthy weight, right?
Yes. Just as you were saying, just choose the right diet. Don't look into the very, very low calorie diets because they don't work, they're not healthy. You know, we know that calorie diets that are about approximately 1,500 calories are the ones that we like to see for patients to some weight loss. Most of the diets that are indicated by the agencies is about 2,000 calorie diets. Okay. So as long as we decrease the amount of calories and improve the quality of the food, you know, that's the first thing to do. Turn off the TV, turn off the computer, and if you have to turn them on, do it in front of with a walker or rowing or doing some activity.
And if you need to take the baby steps, during a commercial break is a great 2-minute period that you can just get up and move some. If you're starting slowly and building it up, those are some great ways to do that, right?
Yes. Teaching our kids to become healthier is by us giving the right example.
All right. Well, thank you so much, Dr. Reyes. We really appreciate your time.
Anytime. Thank you for inviting me.
And that officially concludes our webinar. Thank you for joining us. We hope you will continue to prioritize your health and the health of your loved ones. We hope to see you for our next installment of this Let's Talk Your Health series on Tuesday, February 17th from 5:30 to 6:30 p.m. when we will discuss heart arrhythmias. Like and follow the South Texas Health System Facebook page for more details on our future Let's Talk webinars. And if you'd like to see our previous Let's Talk seminars, all you have to do is visit sthsletstalk.com. Until our next seminar, stay healthy, stay safe, and please prioritize your health.
At South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family.